Hi, my name is Dr. Wade Binley. I'm the founder and clinic director of the IBSolutions Method, a functional healthcare model. Today I'm teaching on the triangle of health. When I became a doctor, I learned that doctor means teacher, and the number one priority a doctor can do for his patients is actually teach the patients how to heal, and then maintain their optimal health with them. Unfortunately, this concept has been forgotten. For the last 100 years, our nation is on a downward spiral of chronic illness. As a matter of fact, our nation is rated 37th out of 39 industrialized nations in terms of overall health. For example, 54% of our population suffers from some form of autoimmune disease, and that's the number one epidemic that our healthcare is facing today. Well, maybe it's the type of treatments that we have, and maybe it's the concept of only trying to suppress the symptoms of a disease. You see, our nation consumes 67% of all the prescriptions in the entire world. And unfortunately, those prescriptions taken as directed are the number three cause of death in our country. So there has to be another way, and that's why there is functional health care, is to deal with this part of health in the space of chronic disease. You see, we've figured out ways to evaluate people and then reverse engineer their health crisis so that they can maintain optimal health and actually return their health back to normal. So let's get started. As you can see, there's an equilateral triangle with three different characters. There's a physical side, there's a chemical side, and then there's a mental side. And in the center of the triangle here, we have our genetic material. Now that is the core essence of the triangle of health. You see, the physical side, the mental side, and the chemical side actually influence our gene expression. So our genes are not good nor bad, they're good. And we get a set from mom, we get a set from dad, and then upon conception, they meet and they share their genetic material with us, so that makes us unique. So we have this genetic authenticity that actually comes with variations. So we can't treat everybody the same. So we have biochemical individuality, and functional healthcare provides and allows for that. So when this genetic material gets information, it's getting information from our lifestyle choices. What kind of foods we eat, how much exercise we have, what is our mental state? Are we in good moods all the time, or are we in fearful state, or are we happy and we're loving? These have direct influences on our gene expression. So our genes are basically receptors of all this information, plus the surrounding environment in which we live. And the genes will do one of two things. They're either going to maintain and have the opportunity to maintain optimal health at your highest ability, or they're going to send out messages to your body. So they write this narrative of your health. Those messages are genetically crafted that are individual to you. So they are authentic messages like no other person can have, only you for your response to your choices and the environment that you live, that actually make a symptom. So those symptoms then, they are genetically crafted for you to change your lifestyle. So genes are good. They're trying to protect you and they're trying to optimize you all the time from the very beginning of conception. So what I'd like to do is I'd like to expand upon the triangle of health and give you a little insight about what the IBSolutions does with the triangle of health in opening up the physical side of the triangle, how I do the mental side, as well as the chemical side. So first off, we know that the primary goal is to understand how well your body works, and that's the physical side of your body. So we have to evaluate three things. We evaluate body composition, we're evaluating the integrity of your tissues, and then how those tissues function. An example of understanding the value of the integrity of the tissues is for example, would be understanding the gut lining of your gastrointestinal tract. Maybe you've heard of leaky gut syndrome. Well, leaky gut syndrome is real, and we know that if the integrity of that tissue is failing or compromised, then that is a pre-autoimmune condition. And I just told you that 54% of our country suffers from autoimmunity, and 70% of those causes are in the gut lining. Another barrier to evaluate is the blood-brain barrier. The blood-brain barrier is a specialized membrane between the capillary bed and the brain tissue itself. So if you have an unhealthy or a compromised integrity of the blood-brain barrier, then there is going to be toxins entering your brain, causing brain inflammation. And we know that this blood-brain barrier leak is actually a pre-autistic condition and a pre-Alzheimer's condition, as well as a slew of other neurodegenerative diseases. So you can appreciate the value of understanding the integrity of these tissues and how that translates information so that you can optimize your physical abilities. So let's look at this other side, the second side of the triangle, which is our mental side. I've divided the mental side into the spiritual side of the triangle, emotional side, and your mindset. So collectively, these make up our mental state. The goal of our mental state, our mind, is actually to keep us safe so that we can survive this life. Now, it's important because there's ways that we can do this. So spiritually, we're either connected or we're disconnected, and that's a choice that we have. We can maintain constant contact with a higher power in our life. We're going to benefit from that. If we understand our emotions so that we can overcome fears and the whole collection of emotions that are under the fear side and manifest love in our life and act and manifest all the emotions and the character traits under the loving side of our emotions, then we are going to have a more fulfilling life. So the spiritual side and the emotional side actually contribute a lot to our general mindset and our mental state. So our mindset here, there's two basic polarizing mindsets that I come across in healing. One of them is an optimistic mindset, which is the goal. So we find that people who have optimistic mindsets, they heal everything well. The pessimistic mindset or a fixed mindset, unfortunately, they're stuck in their emotions, they're stuck in their attitudes, and they have a tendency to suppress their feelings. And those suppressed feelings over time are going to come up somewhere in the body. It might be a behavior or it might be a disease, but certainly it's going to prevent your mind from functioning at its optimal level. And opposite of that is the optimistic or growth mindset, which allows for change. And that's what you're trying to do here. Remember, our symptoms from our genetic material are trying to get us to change our life. But we have to use our mind to do that. Now, the third part of the triangle is called the chemical side. This is our biochemistry. And there's three different sides of that triangle. There's a nutritional side, and I collected the infection and toxin side. Basically, toxins is one side, and then allergens. So in the IBSolutions method, I teach my patients that there are 6 root causes of all diseases. See, there's a nutritional deficiency. There's going to be some level of infection. There's going to be a toxic load. There's going to be an allergenic response in the body. There's also going to be unresolved traumas, and that could be a physical or a mental or toxic exposure acutely or collectively. And then there's going to be our genetic variability. So the beauty behind the chemical and biochemical testing that we do in functional medicine really separates us out from other healthcare disciplines, because we're looking for whys. We're looking for those root causes of why your body and your systems have gone awry. And remember, it's lifestyle that brought you in there into my office, so your best lifestyle choices bring you in. So there has to be a differential to determine and discern what has gone awry in your life. So 4 of those root causes are going to be determined by the chemical side of this triangle. So let's break those down just a little bit further. So the nutritional side, we know that nutritional deficiencies are part of the root causes. And we can test for up to 6 months of nutritional deficiencies and the activity and the integrative activity of those nutritional deficiencies and how everything works together inside of a cell. We also look for infections, so we do different tests for that. We do stools tests. We're going to do sampling from our mucus linings in our body. We're going to look at urine analysis and blood analysis as well. Toxins, we're looking at blood, urine, saliva, as well as hair analysis, whether you have a heavy metal, a solvent in your body, a plastic, some environmental poison, or pesticides. We're also looking at the effects of perhaps the medication that you're taking, because it's not only the medication itself that may be toxic, but it might be some of the ingredients within the medication that you're taking. And those can actually have unintended consequences that lead to diseases. So it's kind of a conundrum for those who are taking multiple medications. And it's not uncommon that I'll see a patient that has 10 to 12 different medications trying to suppress all these symptoms, and they just add more and more and more medications because these symptoms are coming up. And like we said earlier, the genetic expression of those are trying to get you to not change your medication, they're trying to get to change your life. And perhaps that message is to do something different with yourself so that you can avoid the medications. And then the fourth part of this triangle the third part of the triangle is the fourth cause or root cause of disease, and that would be allergens. And we look at delayed allergenic responses. We're also looking at acute allergens, and we can test up to over 500 different allergens that is done through blood. So allergen, whether it's an acute allergenic response or it's a delayed allergenic response, have the same effect on the body, and that's tissue damage. And between the toxic load, the infections, and the allergens, and we're going to find a lot of our answers on why you have a chronic disease state. So in conclusion, the triangle of health is actually a teaching model as well, because we can get you to evaluate your own physical side. We can help you understand and overcome mental obstacles as well as get into your body's chemistry to optimize its function, because the goal of maximizing and potentiating your chemistry is actually learned in the evaluation of the laboratories. And what we try to do is we try to understand what you need to remove from your body, whether it's an infection, an allergen, or a toxin. And then we look at the nutrition status to add to your body. So all of these allergens, the infections, toxins, they are going to deplete your they're going to deplete your nutritional status. So what we call organ reserve is going to be compromised. And those patients that come into me that are searching for answers, we usually find most of them right here. And that's the beauty of functional medicine. So this is a different health model. It's very effective. And it would be my honor to be able to help you with some healthcare challenge, whether you have obesity or your high blood pressure, high cholesterol, or some thyroiditis condition, irritable bowel syndrome, chronic autoimmune conditions like rheumatoid arthritis or multiple sclerosis, skin eruptions. These types of things are the symptoms, the result of symptoms over time creating a disease process. So I hope this has been helpful for you. My name is Dr. Wade Binley. I am the founder of the IBSolutions Method, and I love health. I love to learn about it. I like to teach about it. And of course, what I love most is integrating these systems so that I can help you improve your own health. And if you would like to do that, you can contact our office at the IBSolutionsMethod.com. It's called IBSolutionsMethod.com. Or contact us by phone, 949-661-9777. We do virtual appointments as well as mortar and brick appointments. We're available for you to meet your healthcare challenges. My staff is dedicated to understand how we can help you. So we do these discovery appointments as well. It's just an introduction 15 to 20-minute appointment where we can do this by phone or in person, and you can come in and down and sit down and let me know your health challenges and to see if I would be a good fit for you, and the method of the IBSolutions method would also be a good fit for you. So you can begin to sort out your health challenges and return you back to health. Thank you for listening. Once again, this is Dr. Wade Binley, founder and creator of the IBSolutions method.